each other say, is it A and it goes to E, or is it E and it goes to A?
For what?
Okay, what about 99? Or
Okay,
Blue
yeah.
Moon. When you say Blue Moon, all I'm gonna think about is beer.
Or 1, 2, 3.
Okay. Whispering pectoriloquy is 1, 2, 3. Then we have 99. Then there is another one that is egophony, and it's either A and it goes to E, or it's it's E and it goes to A if it's consolidated. You're shaking your head yes, like you know.
I was like, I don't remember that.
Am I right?
The long sound volume, yeah. Because
Okay.
like, yeah, and it sounds like A, like A. That's how I remember.
So you want to start listening to each other, because then you should hear what normal is. Are any of our patients normal?
No.
No.
No. And you're going to get confused, like, because you're going to think abnormal becomes normal to you. And then when you hear a normal patient, you think that there's something wrong with them. All right, so go play.